Hello, my name is Deepo and welcome to my channel. If you're remotely interested in working as a cybersecurity analyst or within the cybersecurity department in the healthcare industry, this video is for you. In this video, we're going to cover three major topics. The first is what's the impact of cybersecurity breaches in the healthcare industry? The second topic we're going to cover are some of the key regulations that you need to know about. And then the third is what are some of the key skills that I think hiring managers are hiring for right now. Stick around and learn more. So let's talk about impact. I did some research and noticed that the Department of Health and Human Services has already reported 305 breach cases by July 2025. To put that into context, the whole of 2024 had 385 reported breach cases. I also wanted to learn about the biggest breaches in 2024. The combined breaches of Change Healthcare, Kaiser Permanente, and Ascension Health alone have exposed the personal health information of over 200 million people. That's more than 60% of the US population. So, why do threat actors target healthcare? There's a dangerous combination here. The first one is that a lot of these organizations have a large amount of sensitive information concentrated in various systems. Number two is the fact that some of these organizations don't have as strong of controls as they need to be protecting this sensitive information. Number three is the willingness to pay. A lot of these organizations are willing to pay a large amount of money in order to get their systems back and running or to ensure that their data is not leaked. We've learned that some of these organizations that have been victims to threat actors have paid up to $22 million only to have their data still leaked. So, let's talk about some of the most common threat vectors. The first is ransomware. This is where an attacker has successfully encrypted an organization's data, and the organization is not, or the healthcare organization is not able to get anything done or access any of their systems or files. Typically, the attacker is asking for some sort of ransom that's going to be paid via Bitcoin or some sort of crypto wallet so that they can go ahead and unlock the organization's systems. The second is phishing and social engineering. This is where an attacker is trying to get an organization's employees to click on malicious links so that the attacker can deliver its payload. And number three is insider threat. Believe it or not, a lot of data breaches are still being caused by employees not really paying attention to what they're doing. Sometimes employees are emailing sensitive information to the wrong person, and this also is a form of data breach. Next, let's talk about some important regulations that you should know about. The big one is HIPAA. HIPAA is the Health Insurance Portability and Accountability Act, and it regulates how protected health information, or PHI, is accessed, stored, and shared. It allows health information to be used only for treatment, payment, or health care operations, nothing else. HIPAA also has the security rule, which require healthcare organizations to implement safeguards across three major areas. The first is administrative controls. The second is your physical controls. And then the third is your technical controls. Now, these controls are combined to provide a secure layer of information protection for sensitive information. Failure to follow the HIPAA regulation can lead to serious fines and, even worse, data breaches. Another important law you should know about is the HITECH Act. This law is important for two major reasons. The first is the adoption of electronic health records by healthcare organizations. And then the second is introducing the mandatory public breach notification when PHI has been compromised. Now, laws tell us what to do, but frameworks tell us how to do it. That's where standards like the NIST Cybersecurity Framework, as well as High Trust CSF, come in handy. Especially High Trust. High Trust is a certification that proves that an organization maintains a high level standard of cybersecurity practices. So, what skills are in demand if you want to work in cybersecurity in the healthcare sector? Let me give you 3 that stand out right now. Number 1 is third-party and vendor risk management. Healthcare organizations rely heavily on vendors for software, billing systems, and data processing. If one of those vendors gets breached, the healthcare provider still bears the risk. That's why the ability to evaluate third-party security posture and respond to external incidents is crucial. Number 2, incident response and business continuity planning. It's not about if a breach will happen, but when. Strong planning helps organizations respond quickly and continue serving patients even during a cyber crisis. Number 3, security awareness and training development. Healthcare organizations must invest in training that keeps up with emerging threats. Whether it's phishing awareness or secure use of medical device, training is the front line of defense. To wrap up, here's the bottom line. Cybersecurity in healthcare is all about balancing risk and compliance, while still supporting patient care and operational goals. So, if you're looking to enter the field, focus on regulations, real-world frameworks, and in-demand skills like vendor risk, incident response, and user awareness training. If this helped you see healthcare cybersecurity more clearly, let me know in the comments. Thanks for watching and stay secure.